New study out showing an alarming link between COVID-19 and heart attacks. Researchers say the virus is to blame for millions of people suffering from heart problems. Joining me now in person, I have NewsNation medical contributor and board-certified cardiologist, Dr. Dave Montgomery. Hello, sir.
Great to be with you. I know.
To meet you.
So excited. Yeah.
Yes. Thank you for being here. The numbers are just staggering. It's like 72%, better chance of getting a heart attack or a stroke. Is that for everybody across the board, or people with underlying health conditions?
I was really alarmed by the study, and I think there's a lot of questions left. We're not thinking about COVID like we used to, right? It's kind of in the back of our minds. A lot of people still dealing with it. Last week, 400 people died from COVID. But this study is talking about 3 years down the line, Markie, where the heart disease event risk, we're not talking about mild heart disease, heart attacks and strokes, goes up compared to people who never got COVID-19. That's what this study is saying, and it's sort of raising a lot of questions in cardiology.
Yeah, because when I was reading the study, I was like, well, I've had COVID twice. You know, what does this do to me? Does the severity of your case come into play here when it comes to heart issues?
Yeah, that was one of the other alarming points. Not as much as you would think. Everybody across the board, there were 10,000 people in the study, by the way. 10,000 people, and they saw no matter what the severity of your COVID-19, your risk of having a heart attack or stroke increased in the 3 years. This is 3 years down the line. There was a sub-analysis, and in that sub-analysis, the people who had very severe COVID-19, hospitalizations, ICUs, that kind of thing, yes, they did have a higher risk, even compared to people who have a history of heart disease, and that was alarming.
Yeah. So what should we do with that information? And the study, it's like, do you go get heart screens even if you're feeling fine? Do you change up your diet? What do you do if you've had COVID?
You just set me up perfectly. You know, anytime that I can tell people, let's go get your heart screened, I'm here for it. That's exactly what this is about, because most of heart disease is preventable. COVID-19 related heart disease is preventable. One of the things that they showed in the study was that people who happened to have been on aspirin for different reasons had a lower risk of heart attack and strokes. Well, that makes sense because that's one of the things that we use to prevent heart attacks and strokes. So go get your heart screened and talk to your doctor about your risk of COVID-19 leading to heart disease.
What about blood type? Does that play into this at all?
Another really kind of shocking fact. This has been sort of coming around. You're right. We're still trying to understand it. This was early in COVID-19 when we were seeing that the ABO blood group, your blood type, actually may play a role in how severe you get COVID-19. It's showing up in this study as well, which was done, years later, that the A and B blood types increase your risk for having heart disease after severe COVID-19.
Interesting.
So still some questions to be worked out, but still something for us to think
And speaking of, the other thing I wanted to ask you when I knew that I would have you in studio this morning is there's still, to your point, so much unknown. This was such a sudden onset of a pandemic. It's such a sudden response in a vaccine to roll out to it. What's your biggest lingering question that you want answered about COVID?
Well, I think right now the long COVID question is big, right? We still don't understand exactly why people, weeks to months later, still have really bad symptoms. Fatigue, brain fog is a big one, heart racing, blood pressure problems, up and down, by the way. And really us understanding, because if COVID's going to be around for a long time, right? I've said that on NewsNation Air, it's going to be around for a long time. How can we really get to long COVID and stop people from suffering for so long?
And the numbers of this, too, 10,000, also I was reading it, compared to 150,000 people infected with COVID to a control group of over 11 million who tested negative for COVID. So often you read these studies and it's like, we talked to 1,000 people.
Yeah, very small.
The numbers kind of, hammer it home.
Yeah, and that's why I liked the study, because they really did do a good job in getting the numbers to at least have us say, this is a real question that we all should be thinking about. I think the main takeaway here is go get your heart screened, talk about your entire history. COVID-19 may now be a risk factor for heart disease.
Okay, just be honest and open with your doctor. Dr. Dave Montgomery, so nice to meet you.
Pleasure.
You're helping me with everything. He's hooking me up with a dentist here in Chicago this weekend, too.
Full service.
Full service. A house call for us here at NewsNation.
That's right.
Thank you, sir.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.